35th Congress of the European Society of Medical Oncology in Milan is now in full swing. In the last few days, we have witnessed some major advancements in the treatment and care of cancer patients. The meeting has covered a broad range of oncology-related topics. We have seen data from cutting-edge studies on breast cancer, lung cancer, as well as gynecological and prostatic tumours. The transfer of this data to clinical practice and the management and rehabilitation of patients into everyday life has also played an important part in the scientific sessions. ESMO has a keen and active role in the training of young oncologists. A significant part of the Congress sessions have been dedicated to educational issues. An ESMO award session included fellowship awards, together with the Lifetime Achievement Awards. Today, the most important highlights were covered in the presidential session chaired by ESMO's President, Professor David Kerr.
Dr. Dubono and al. present a randomized phase 3 double-blind placebo-controlled study in patients with metastatic castration-resistant prostate cancer. These patients have received either 1 line of docetaxel chemotherapy or 2 lines of prior chemotherapy. In these patients, there is very little available for them. They have evaluated a novel hormonal therapy which further drives the androgen receptor signaling axis, even in those patients who appear to have castrate levels of testosterone. Their results are extremely interesting. They show a 35% improvement in overall survival in patients who have already failed prior chemotherapy.
We've just seen some very important data from the ICON 7 investigators presented by Dr. Perrin related to the use of bevacizumab in combination with chemotherapy in patients with advanced stage ovarian cancer. This trial follows a similar pattern that's already been established through the Gynecologic Oncology Group in the United States with GOG 218, and it truly establishes the importance of targeting angiogenesis in this disease. There are questions we have about when to use bevacizumab, what the optimal timing and duration of therapy might be, but this is really a very striking accomplishment to have 2 large randomized phase 3 trials that really show concordant findings and will certainly be driving research in the future.
We are speaking now from the study of Pavel about the comparison of placebo plus octreotide versus everolimus plus octreotide in patients with non-pancreatic endocrine tumors. 429 patients have been randomized in this trial. This is a huge trial for this kind of rare tumors. And the results are quite interesting, showing that the addition of everolimus to octreotide is able to improve the progression-free survival of the patients. The problem is that this improvement in progression-free survival is not completely statistically significant. But for me, I think it's a very interesting result because we have for the first time a targeted therapy that is active in this specific field of non-pancreatic endocrine tumor. And considering the fact that these patients are very difficult to treat because they have indolent tumors and we just have either very aggressive treatment such as chemoembolization, either somatostatin analogs, but nothing else as a medical treatment to treat them, I think this new option could be very interesting and useful to treat these patients.
Hasn't it been a fantastic meeting? 15,000 people, 12,000 doctors. I think in terms of the quality of the people who've come, in terms of the quality of the studies, in terms of the quality of the science, at our 35th birthday, this has been the best ESMO meeting of all time, and I hope that you all agree with it. We've seen practice-changing results, practice-changing science in the field of breast cancer, ovarian cancer, lung cancer, some wonderful studies linking new treatments to biomarkers. and of course that wonderful prostate cancer study that all of us heard in the presidential symposium. So we're going home sated with information, full of education. There's a real buzz and momentum about the meeting, and I couldn't be more pleased about it. I'd like to thank you all for coming, of course. I'd like to thank the many speakers who put so much time and energy and intellect and their thought into this, and of course the ESMO staff who've made this, I think, one of the most seamlessly flowing meetings of all time. I think that we can only get better, and I think we're talking about good science, better medicine, best practice, and I think that's all that ESMO stands for. And I look forward to welcoming you all to the next ESMO meeting, our 37th Congress in Vienna in September 2012. See you all then. Thanks.